Hi, everybody. This is Josie, and you've tuned in to Josie's Point of View, where we focus on human interest stories from the Carolinas and beyond. Our story today comes from Wilmington, North Carolina, and here's the story headline. And it reads, oral surgeon accused of sexually abusing patients under anesthesia in North Carolina. I came across this story while reading about another crime recently committed by the same person. I'll provide you with a summary today, and I'll place a link to a few of the articles in the description box. Okay, let's get started. So our story today is about this man right here. His name is Michael Lee Hassan. He's 55 years old, and he had an established oral surgery practice in Wilmington, North Carolina. I say had because he was forced recently to stop seeing patients. Well, sometime last year, a few patients started coming forward accusing the doctor of assaulting them while they were having a procedure done and while they were under anesthesia and helpless. Well, around February of this year, he was initially arrested on 4 counts of sexual assault and rape. And by May, he had been charged with over 30 charges, including 3 charges of indecent liberty with a child, 17 counts of sexual battery, 1 count of felony statutory rape, and 9 counts of felony second-degree sexual offense. The alleged offenses were reported as taking place between 2009 and 2018. There were a total of 23 victims ranging in ages from 12 to 69. Now police are trying to figure out if there could be additional victims out there who have not yet come forward. Initially, his bond was set at $1.2 million, but he was eventually able to get it reduced to $550,000, and he was placed in house arrest. He had to surrender his passport and was subjected to electronic monitoring. As part of the agreement, he was to have no contact with any of the victims, and he could only leave his house for medical visits. The Board of Dentistry also took away his license to practice, and he was also no longer able to administer anesthesia. So, in reality, he no longer had the means to work in the field. Police say they began investigating the doctor as soon as the first set of complaints came in, and that was in 2017. And it was more than a year later before he was arrested. So people began asking what took the police and the district attorney so long to bring charges against this doctor. The initial response that these types of investigations normally take time because you need to get results from rape kits, and you also want to make sure you have enough corroborating evidence to support an arrest. And I fully understand their position, but I am just wondering how many more women were assaulted during the time the police was sitting on the charges and he was allowed to continue his practice. Maybe if he was arrested sooner, there could some of these victims could have been spared from being assaulted. It also seemed at the time that he was given a sweetheart deal because facing over 30 counts of rape and sexual assault, and he's able to get his bail reduced, and then he's placed on house arrest. These actions did not seem as if the district attorney was showing any compassion for the victims. Well, the doctor appears to be a repeat offender because on July the 8th, he was back in the news again. Yes, because he was arrested again. This time, he was arrested for allegedly assaulting a woman believed to be his girlfriend. The alleged incident occurred at his home, and according to reports, he had been drinking at the time. Now, yes, he was arrested and he was given a $50,000 bond. But I'm saying just wait one darn minute. This is another arrest and he was still given a bond and released to go home again. How is that possible? How is this any kind of justice? Makes you wonder if he's pretty much being rewarded for bad behavior. But I'll continue to follow this one and I'll update you as more information becomes available. Well, that's all I have for you right now. But leave me a comment below and let me know how you feel about this case. Do you feel this doctor is being given preferential treatment? I believe he is, but you may disagree. And if you have not done so already, I want to invite you to subscribe to my channel by clicking on the red subscribe button at the bottom right hand corner of your screen. And if you click on this notification bell right here, you'll be the first to know whenever a new video is uploaded. I thank you for watching and I'll talk to you soon. Bye.